Practicing medicine without insurance is possible. Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. 𝗬𝗏, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. I want to welcome Dr. Vanessa Rodriguez, an endocrinologist in South Florida, here with us today because we will be talking about how Dr. Rodriguez started her direct care practice, which is a membership-based practice. And me as a podiatrist, I'm only really gathering the data as to how I'm going to create a membership. I have packages, but I don't have the traditional DPC practices where it's exclusively one price and it's a done deal. Mine's a little bit more complicated, but that's how I like it. That's how my brain works. And I'm wondering how things are going with you. So welcome to the podcast, Dr. Rodriguez.
Everyone for having me. It's really a pleasure being in the show.
Awesome. Let's get into it. Why did you choose direct care? What was life like for you before you had your practice?
Well, I've been in practice for 21 years, and I've been through the whole gamut of different types of practices. So I first started with a multi-specialty group, physician-owned. Later on a hospital-based, physician practice. Later, a small. And it doesn't matter where I was working; it was always kind of the same theme. You got to see more patients. You gotta be quicker with your appointments, and I just couldn't do it. I've been always one to believe in education, so I take my time with my patients. I believe that you can take care of your diabetes if I tell you exactly how the insulin works and why we do this. So I would really spend a lot of time with my patients, and unfortunately, didn't matter where I practiced, it was always the same thing. You have to see more patients. So I decided to open my own practice approximately 11 years ago. And I said, I'm going to do this better. I'm going to do it my own way. I'm going to take my time. But I still continue with insurance-based, right? That's what I knew. And fast forward, 9 years later, I was in the same problem, right? I was taking my time. I was doing things how I wanted to do them. I was big on customer service and making sure that the patient felt comfortable, that they felt heard, and I was there for them. But, insurances, unfortunately, had forced me to be I needed to see more patients in order for the practice to survive. And it came to a point that I said, okay, I'm leaving medicine. I just couldn't do it anymore. And I told my husband one day, I'm done. I'm going to do something else. I tried it my way. It didn't work. Actually, I started looking for jobs, and I love patients so much. I couldn't see myself maybe working for, even a non-for-profit or maybe a pump company, insulin pump company, just, on a desk. I needed to see patients. So I started looking for more. And I was very fortunate to come across the DSC Alliance. And I had heard about DPC. I knew that DPC was a wonderful way to practice, but I never thought as a specialist I could do it. And I remember that evening when I saw the DSC, I'm like, okay, well, let me see, can endocrine do this? And in a matter of minutes, I found 10 different endocrinologists across the nation, nobody in Florida, but 10 different endocrinologists that were doing this. And I remember I said, this is what I'm going to do.
So you had reached out to the Alliance and you saw other people doing it. So how did you decide to create it for yourself? What was your thinking process in creating a membership for your practice?
The decision about, once I made the decision that I was going DSC, I was going to go full force. It was either because I see practices that are hybrid, right? Some take insurance and some are membership based. And I said, if I'm going to do this, I'm going to give one last try at medicine, and I'm going to go, 100%, direct care. And I was going to do only membership. And I have to say that I'm not entirely membership, and I'll tell you how that process started. When I said, okay, I'm going to only do membership, then I started thinking, okay, membership is wonderful. And I know that all my patients with diabetes, this is exactly what they need. But even though as much as I love diabetes, I have type 1 diabetes myself. This is the reason I went into medicine. I love diabetes and it's my passion, but I also love all endocrine. So I was thinking about my patients with osteoporosis that would see me only once or twice a year, and the patients with thyroid nodules that I would do their ultrasounds, maybe, once or twice a year. I wanted to be able to do all endocrine. So initially, when I made the decision and I was trying to sort out, prices, and I was gonna, what services to include and all that, then I decided for the patients that were transitioning to my practice, because I had already had an established practice, transitioning to DSE, I figured, okay, well, I'm going to offer the option of, fee for service or pay per service. And if it's diabetes, it has to be membership. So that's kind of how I started. And I would say about half of people, signed up for the membership, and about the other half were fee for service. But I later on, about a year later, now it has been 2 years since I've been in direct care. So about a year later, I realized it's difficult for me to differentiate, how much services or how much I offer, to each patient. So in other words, like I wanted to make sure that the members had, my cell phone number in case of emergencies, they had access to me. And everything is covered. So if I need to do a prior authorization for a medication, or they need an ultrasound, or they need a biopsy, everything is included. But I came into the problem that for those fee for service, then I felt limited. Like I wanted to communicate via cell phone. I wanted to, if they needed a PA, then I had to ask for their permission. Hey, remember we have a fee for prior authorization. And I felt like I was not giving my, I cannot give my 100% as I do with my members. So to give an example, if I get a prior authorization for a diabetes medication, like I get it, and now as direct care, I can take care of it right away. In a few minutes, I'm done with the PA, and I usually get an answer within, the same day or the next day. But with a fee-for-service patient, I'm like, okay, can I do the PA? Is it okay? Is it okay if I charge your credit card? And then I felt like there had been a delay, sometimes they wouldn't answer me. And then it's a week later, and I'm still not done with a PA. I'm like, it's been frustrating. So about a year ago, I decided, okay, I'm going to keep the fee-for-service that I have. And right now, I'm not taking any additional fee-for-service. It's all membership, because I figured it's just easier for me, and not only for me, but also, to the patients, for them to get the full experience of direct care. If it's all seamless, right? You need something, I take care of it right away. You have a question, I don't have to bring you in for, another visit. I just, we take care of it right then and there. And that's the beauty of direct care. That's why, even though initially I had decided to offer both, right now, I'm only doing membership, but I'm keeping, those fee for service that I had, which were, my patients, that I've had for many years. And, but I'm not taking any new patients as fee for service. It's all membership.
I think what you've just described is what most of us will ultimately do when we jump out of insurance, because we do all the things, we serve all the people. And I heard Alex Hormozy on his podcast say something that has stuck with me till now, to this day. He said, when you build a business, you really want to focus on one avatar with one service line until you hit your $1 million. And he just simplified that with such ease. And it made me think about why myself, with all of these great ideas that we have, why we keep feeling stuck or overwhelmed. And it's because when we come from the insurance model, we were literally serving every single body, every body that came through, right?
for whatever problem they have. Sometimes it's a mixed gamble. You know, it's not just diabetes, it's like a complication of it, or it's something else that shows up in it, or it's like, oh, I've got one more question, doc, kind of patient, or they come late. And I think you hit the nail on the head as to the value of a membership. If you just have the membership, you don't have to sort out and penny pinch the patient's interaction each time you do something for them behind the exam room, right? Or when they're no longer there, we're still doing follow-up care. We're still charting, we're still talking to the people we need to talk to so they can get the things that they need. And I feel like I'm in that place right now with you. I've opted out of insurance 3 years ago, but I still kind of wax and wane between my surgical procedures into the medical care that people really need, which is educational. It's preventive care. It's making sure small things don't get big, that you don't end up with an amputation or you don't end up with a chronic pain issue. And I really just wanted to highlight the idea that membership is just the way business goes to offer financial stability. So once you decided to have that membership, what else changed for you? Did life get easier? Did it get harder? Did you still have conflict? What did it do for you?
Well, I think, I think it's much easier. I still have a big portion of those fee for service, but it makes it much seamless. As I said, I think that's when you think about direct care, that's how I envision it, right? So it's seamless. People, you take care of things as they come. What I would say, and just to kind of segue to that, what really made a big difference, and I would say mostly financially, is when I changed my, when I left my office. I used to have an actual office space, and my lease expired, and I thought it was the end of the world. I was not, I didn't have an office space because I had been negotiating with my landlord, and it turned out that we couldn't come to an agreement. So I find out on a Sunday evening that he was not going to renew the contract. He wanted me to do a 10-year lease, and I didn't want to. And I find out on a Thursday, and my lease expired on a Monday. So I only had a few days to leave the practice. Grab, find a mover and, grab all my stuff, put it in a storage. And I phoned a friend who's a DPC that I met at the Chamber of Commerce. And she was using this co-working space, and she really, really loved it. And I was able to find a spot and got started on the co-working space by Monday. And I'm telling you, it's one of the best decisions that I've made. I never thought that was going to make a big difference. I thought it was going to be temporary, but I've been there for a year, and I really, really think it made a big difference in the practice financially. Controlling overhead is one of the biggest things that we must do as we're doing direct care. And not planned, but it just happened. And I am so happy that it did happen, because it's been one of the game changer, definitely, in the practice financially. So I highly recommend, to keep your mind, to keep mind open. We always think that we have to have like an office space, but a co-working space in the direct care. We don't need a lot of space. At least me as an endocrinologist, I just need a room. That's it. I just need a room to see somebody. So it's really financially made a big impact in the practice.
Could you elaborate a little bit more on what this co-working space actually looks like for you, and what were the terms? Were they month to month?
So they do have a monthly membership that I opted to use, because then you get a lower fee per hour. But this monthly fee is like, minimal in compared to what the rent, was. We're talking, a couple $100, versus, $4,700, a rent. And then you just rent per hour. So I usually rent the same room so that there's some consistency. These rooms are very modern and very kind of stylish. They have a little waiting room where the patients just text me, hey, I'm here. I just bring them to the room. Very comfy, has a desk and a couple of, couches. And I just rent it per hour. So if I'm on vacation, I don't have to rent it. The days that I'm on telemedicine only, then I don't go. I just see the patients, telemedicine from home. I just had to, reserve a couple of lockers there just to have my stuff. I have my ultrasound machine over there, so I have it in a little cart. So when I do my ultrasounds, then, I just bring my ultrasound there to the room. So I have all my supplies over there, in a few lockers, but it's, very, very kind of quiet, and it's all medical. So it's kind of a nice vibe on 𝘬𝘧𝘬𝘀, which is a nice place near to the beach and touristic area.
I've heard about co-working spaces out here in California, like in the Beverly Hills district, where they would do, as you're explaining, subleasing it, but I never knew what that would cost. So are there more companies now doing shared spaces for medical?
I don't know if it's considered a shared space, right? Because I literally, there's maybe 16 rooms over there. So people just rent them as they need them. So I just happen to, because, I'd like to have the same room, then I just reserve it months in advance. Like, I have it reserved, probably till February, of next year. So I always have the same room, but then I go ahead and cancel it. For example, Wednesday, I'm all telemedicine. So I just went ahead and canceled my day for Wednesday. So it's very flexible. But I personally like to have the same room just so there's some consistency, and, people see like it's kind of my office, but it's really not. Anybody can rent that room if I'm not there.
Let's hop back into your practice as to who your best patients are. Could you give us an idea of those who maybe are new to the idea of direct care? Who actually pays out of pocket for your services, and why are they choosing you?
So when we were thinking about direct care, and when usually you think, well, this is for the wealthy, right? And to be honest, it doesn't, or for people that don't have insurance. And I was looking into the practice, and I would say everybody has insurance. All my patients have insurance except for maybe 2 of them that don't have insurance. My population, because I live in South Florida, we have a lot of Medicare. So always my practice has been at least 50% Medicare. And looking now at my DSC practice, it is about 50%, Medicare as well. So the demographics haven't really changed a whole lot as when I had it at my previous practice. So I think the ones that get the most benefit are my patients with chronic diseases, like, they're diabetes patients, pre-diabetes, weight loss. But I have the whole gamut of endocrinology. So I still have my patients with osteoporosis, and I have my patients with thyroid disease. So it's not only for the wealthy as most people think. I think what I've come to notice is that the patients that really care about their health, they will figure out how to pay for it. Because I have patients that I didn't expect were going to join, and they have. And if you think about it, people spend their money however they want to spend it. They want to spend it in nails, and they want to spend it on, clothing, and, or, they want to spend it on health. So it really surprises you sometimes, who join. So I think what I notice is that it's usually people that want to get better, which is awesome, because you're spending a lot of time with them, and those are the people that you want to help, right? Those that want to be helped, and usually are those that are very pro lifestyle changes, and they really want to work, they want to work as a team, for their own health. Preventative medicine, is a big part in our practice as well. So I think it really, it's not about, what insurance they have or what income they have. I think, it's about, the desire to get better and have better medical care.
How do they find you, or how do you find them?
So I had, I was very fortunate that I had my previous practice, right? So I would say that, in the beginning, it was about, I was able to transition about 5 to 10% of my practice, transition into the DSC practice. And, over the first year, there were still some that were trickling in, that maybe they went to another endo, they didn't want to do DSC, they went to another endo, they were not really happy, and then they eventually came back. I do have, some referrals from local DPCs as well. So which is nice because then the patients already know what type of care to expect, and they already know how the system works, which is very nice as well. But I would say the most are coming, from just picking up the phone call and just calling, looking for an endo. In endocrinology, there's very few of us, so there's always, a big need. And in my previous practice, I never had to, well, most physicians, we don't never advertise ourselves in any way or form because there's such a lack in our specialty. And I think that's the case for most specialties as well. So when I transition into DSC, we still get a good, I don't know, 7, 8 phone calls of new patients per day. And of course, not all of them join because, the first question is, do we take insurance? I want to use my insurance. So that's usually, the first question. So not all of them join, of course, but most of the new patients that we get are people on Google and, finding us. And I think that's one of the very important things of having good, Google presence and, making sure that your patients really, that's how patients find physicians nowadays. They just Google how many stars do they have. So it's good to make sure that you have, your patients review you online. So, they're the ones that are going to promote you the best. And, then we get, from other patients, family members, and that's the other source of referrals that we get.
I saw your Google reviews. You're doing amazing.
Oh,
Do you
really?
pay? Do you pay for your Google ads at all, or is it just all organic?
All organic. And to be very, very honest, our Google reviews were not good. We had like I don't know, 3, or it was like either all 5s or 1s. And across the years, it was. I didn't care about my Google reviews. Like,
Hmm.
I was worked out. I'm like, I was so exhausted. Like, I really didn't care. But as I was thinking about DSC, I said, you know what? In those 6 months, I transitioned, right? I decided I was going to do DSC, and we started 6 months later. So one of the things that before I even announced it to the patients, I started to, send, tell the patients, hey, here's how you can review us. When the patients were checked out, hey, just Google, we review us on Google. And we actually started to get those reviews before we announced that we were going DSC, because I knew that that was going to be important at that time. So then once we changed to DSC, then we continued to say, hey, remember, you can review us here. And, and that's how slowly we've been getting our reviews better. I've never paid for, Google ads or anything like that. I think that if you're having your patients review you, and you encourage them to do it, it actually helps, a lot when you're then, when you're trying to get new patients. And that has been, to be honest, our best form of advertisement, and it's free advertisement.
That's a really good point. We tend to throw money at things and just hope that it grows. And I am guilty of doing such things. Just let somebody else handle it. I just want to be the doctor. Can you just, do all the things? But here we get to simplify it. And I wanted to know, is your area saturated with endocrinologist options? Like, I imagine nurse practitioners, PAs, other insurance-bound endocrinologists are present. But then you also said that isn't a lot. What does that look like in your community? And how do you, I guess, stand out or outcompete, with those options?
Think there's enough endocrinologists nationwide. And, diabetes is growing faster than the endocrinology pool is growing. So at least in our field, there's not enough of us. Doesn't matter where in the map, you look at it. It's really, there's a big need. There's a big need. Most of diabetes is taken care of by primary doctors, but, there's still not enough endocrinologists.
So it's not saturated.
It's not saturated,
and you're
no.
not worried about the competition. So that's,
No.
which is a healthy attitude about it, right? It's just,
yeah, I think it's you have to have a good reputation, and that's one of the things that, if you have a good rapport with the doctors in the community, I think one of the things that helped me is that I'd been in this area already for about 12 years. Even though I don't go to the hospital anymore, when I first got to this area, I went to the hospitals, and that's how you meet, the different primary doctors and the people that are referring to you. And then, just slowly you build your reputation. So eventually, once I stopped going to the hospitals, still those PCPs were referring to me. So, and then it just becomes word of mouth and, and so on. But I think your reputation is so important. And so you have to be really, you got to protect it. And that's why I think the Google reviews and, your online presence is important, because then people will follow. And I think one of the things that helped me a lot is that and maybe you can see that in my reviews, is that I take my time with the patients and I listen to them. People want to be heard. So they're so used to about these, 5-10 minute visits, go, and they had 10 questions and nobody even heard them. So I think that's where my reputation comes in, is that I always, even when I didn't have time, I would sit down and listen and try to address all their questions. And that's why in my previous, practice, I used to be 30 minutes to an hour behind. People didn't like it, but I'm like, this is the way that I'm going to practice, and again, eventually burned me out. But I think that's important, right? Just to listen to people and make sure that sometimes it's just you would have maybe taken the same medical decision, but you took the time to listen to them, look at their eye when they're talking, and they feel heard.
As the owner of a successful direct endocrinology practice, did you encounter early mistakes that you wish you had done as you transitioned out of insurance into the practice that you have now?
Controlling overhead is a big, big one. And I wish I would have known about this co-working space before. I think it's important to have good staff, right? Some people start on their own, right? So they may not have staff. I do have a virtual assistant, and that's been very, very helpful. So over the years, I've learned that it's important to have good support. And I think that was, maybe not with DSE, but I've learned it in my previous 9 years of having my own practice. I always thought that having somebody with experience, or somebody that has done endocrine before, that they knew, the EMR that I was working with. But I could tell you with, it took me so long to realize that what you need is somebody that has a good attitude, somebody that has a positive view of things and is willing to help people, that have that service attitude. Everything else you can teach them. You can teach them the EHR, you can teach them, endocrinology, you can teach her, what a sensor and a pump is. But it's important to have somebody that you really work well with, because she's going to be the one picking up the phone, and she's the one, she needs to believe in DSE as much as you do, because she's going to be the one that's going to be able to convince that patient that calls in and says, do you take insurance? That's her first question. I've picked up the phones before. Is that, you take insurance? Well, this is what we need to do. This is the beauty of this. We accept all the patients, doesn't matter what insurance they have. So, depending how you can easily say, no, we don't take insurance, and then they hang up on you, right? But, so we try to find ways to say, yes, we take any patient with any insurance. We just don't bill the insurance, but we take any patient with every insurance. So it's just kind of opening up the way to listen to what DSC is about. So yes, so having so I've learned definitely having a good virtual assistant. In my case, she's been amazing, and she's the reason why our practice grows, because she's the one picking up the phones and convincing those about what DSC is. So I've been blessed.
You've given us so many great tips, especially overhead control, finding a place where you can just rent hourly. I don't know if I have that in my town, but I'm going to look after we get off the call here. So the doctors are listening. They're interested in direct care, but they're on the fence. They're afraid. They're afraid of something. What would you be telling that doctor about direct care?
I believe direct care is not for everyone, right? But if you've come into a place that you really want to serve the patient and you're not being able to do that with insurance, I think honestly is about educating yourself about what DSC is and taking the leap. Unfortunately, I had to wait until I was quitting medicine to find it. So I'm hoping that most people don't have to get to that point, and hopefully find this as an alternative to practice medicine as it should be. So I would say, if this is for you, don't think about it any longer. If the decision is difficult, and there's, you can think about it, over and over again, but at the end of it is just close your eyes and take the leap. I wanted to take the leap. Once I found out about DSC, I wanted to start it right away. I told my family, I'm like, okay, I can start this in next month. We're going to start right away. But I was fortunate to have, good husband and my sister, who really helped me with this transition. And, my sister told me, okay, we have to plan this, right? So we have to plan this. If we're going to do this, you only have one opportunity to do this, so we're going to do it right. So, she set up a timeline for me. This is when, we're going to finally be DSC. So then we're going to announce to the patients 3 months later. We're going to do letters. We're going to do town hall meetings. So it was a 3-month process for us to get ready, set up a website. I watched this, I read a couple of books that I highly, highly recommend, which are Dr. Farrago's book, The Official Guide to Starting Your Own DPC Practice. I read it twice, actually. I really enjoyed that book. And Julie Gunther's Spark Starts Fires. And I listened to as many podcasts as I could, just like this one. I woke up and I was listening to the podcast on my drive to work, at bedtime, every possible minute that I was awake and I'm not seeing patients, I was listening to a podcast and writing notes, taking ideas. So we planned it, and I was very fortunate that that all those resources were very helpful. And we, now we're in our 2-year anniversary, and I couldn't be happier. I didn't think it was possible, but I'm happy to say that it was the best decision, the best professional decision I've ever made.
Congratulations on your 2 years. I'm so happy for you, and I'm so glad we got to connect. It's not every day we get to talk to other business owners about what sparked the fire, and I am going to check into that book. Thank you so much for that recommendation. You are a wealth of information. If people wanted to connect with you, what's the best way?
They can reach me through my website, which is endocrinologywellness.com. And our email is there, which is info@endocrinologywellness.com.
Awesome. Thanks again, Dr. Rodriguez, for being here. And I look forward to, I hope I get to meet you in person someday, but we'll get to collaborate through the Alliance and in all the places. Thank you so much again for being here with me. One last thing, if you took anything from this episode, whether it's a small dose of inspiration or even an aha moment, could you please share it with a friend or post it on LinkedIn? The direct care community depends on doctors like you because no one is coming to save us. So it's up to each and every one of us to keep the conversation going, to a point where direct care becomes a normalized path for private practice and not some secret that we have to mine for. Thank you if you've already done so, or if you've given this podcast a review. It really does mean a lot to me. Sending you peace and possibilities. I'll catch you next week. Take care.